Well, hello, everybody. This is Dr. Tezzolino. I am fortunate to have our guest this week, Ashleigh Fall. She is a family therapist. And thanks for coming on here, Ashleigh. Thank you for taking the time to be able to come here and talk with us.
Yeah, thank you.
Absolutely. And so like what we're looking to do here, for some of you that have been following us the past two episodes, this is our third, we've kind of really focused a name of what we're looking to do for this webcast here. And we're now calling this, and we'll forever call this, Raising Elevated Families, because this is what we're looking to help provide here in the community is more resources for you families out there, whether you're practice members here in our office or just follow us on the Book of Face out there. We're looking to help provide you with more of these valuable resources that are out in the community that you may not know about. And if you're looking for them, what better way than have someone that you know about already? So thank you for coming on, Ashleigh, today to speak with us a little bit, giving us more information about you and who you do or what you do. And because I know people, even like myself, family therapists, what do they do? But let's get in, before we get into that, let's learn a little bit just about yourself. Give us a little bit of your background.
Personal background, not history. And
kind of, how did you get to this point in a summation overall, I guess?
Well, I became a therapist because I seemed to be easy to talk to. I was always somebody that people would just sit down and start telling me things that were going on. And I was like, this is interesting. So I went to grad school and decided to pursue that area. And I thought I was going to work with couples. But in grad school, I stumbled upon some play therapy classes and just fell in love with them and started changing the direction of where I wanted to focus my work and started working with families and kids instead.
That's awesome. Isn't it amazing like how kind of life just pulls you in different ways? I give it myself. I started off and I was like in chiropractic, and it was sports, and because that's what drew me to get into chiropractic, sports and performance and optimizing that. And now what do? I'm dealing with pregnant moms, infants and kids, and we deal with the family like dads too, but I mean that's really a big focus of ours is dealing with that area. And it's never 15 20 years ago I would never have thought of this as where I'd be, but I'm so happy that I am. And it's life does crazy things as you go along, as long as you don't force it.
It's got to pursue what makes you happy.
Yeah, and it always changes too, right? So what does a family therapist do? I mean, what would you say you do? How do you benefit families that seek your services?
So, so I'm a licensed professional counselor, and I'm also a registered play therapist. So I've had a lot of training in doing this kind of work. And I guess it depends on what the people are coming to seek me out for. In terms of play therapy in general, which can address a lot of different issues with children, it's usually the reason play therapy is effective is that it's a modality for children to communicate, since they can't just sit on a couch and talk about their feelings, and they don't have the cognitive ability and the emotional language to communicate that. They do it through their play. That's how they learn, and that's how they solve problems, and that's how they communicate. And so I have certain play therapy tools to help facilitate that for them, and what they would, whatever it is that they're trying to work on, if that's anxiety, if that's grief, if it's an adjustment, a life adjustment, depression, problems with a sibling or a parent. So I use play therapy primarily, and then I involve the families either in family therapy, or I have parent sessions where I bring the parents in and talk about what's been going on and try and support them and answer their questions and help provide parental support, as well as how they can support their child emotionally.
So do you find that when you're, let's say, so it's, I mean, obviously you deal with the family. So do you find it often that parent or people are bringing themselves to you? It's obviously the dynamic within a family. There's something going on, and is it more of like something going on with the kiddo, and that involves obviously the family, or can it be something going on with the parent and then just help them with the kid? Is that kind of like how?
It's always different. A lot of times the child might be struggling with something, some sort of life adjustment, just started school for the first time is a very common one, or having some social problems, being bullied, or having anxiety over things. And so the parent will, bring the child there initially to address that, but then usually there's other things that can come up along the way that incorporate the family. But I also deal with a lot of children whose parents are separated or going through a divorce, and so the parents usually are trying to be proactive by sending them to me to talk about their feelings and make sure that they understand that the divorce and the separation is not their fault and that their parents still love them, and getting them used to that adjustment of having two homes, that kind of thing. So it's always different.
Okay.
No two cases are the same.
Never. Never. And so let me ask you this, as you know, we care for a lot of kids with like ADHD and sensory issues, autism, and along the spectrums in that area. What would you say as far as, how early is, I guess, how young of a child, where would you start? Like what age do you start being able to do and utilize and benefit from this play therapy?
So I work with children. I actually have a special certification in infant toddler mental health. So I can work with any age group. I would say that I have a majority of my caseload right now are in the toddler age range. I have 2-year-olds. I have a lot of 3-year-olds, 4, 5, 6-year-olds. But I also, I have older children and teenagers, and some young adults that I work with. So really any age range,
Yeah, what I was trying
but I always address the birth to 5 kids with the parent present. They're always with the child when I do therapy with them.
Okay, great. I was kind of getting at, because if there's parents out there, I know there's practice members of ours too, that would be probably asking the question of, all right, I've got, when can I start bringing my kiddo in if I'm starting to see some sensory issues at 15 months old or 18 months old or whatever it is that too early? But I think you addressed that. It's pretty much at any time help along that process.
Yeah, and it would also be something you'd want to work with your primary care physician on. It's not just about the therapy, as you know. There are other things in play that you want to make sure are working for your benefit.
Absolutely, it's a team effort, right?
And
all of it, absolutely. So, is this something you go to somebody's home? Do they come to you in an office setting?
That I work in an office setting, but I have in the past worked for agencies that do in-home therapy. So I did a lot of that in my past, but currently I just work in an office.
Okay. And where do you find most people? They come from across the valley. Where's your office conveniently located?
I am on Scottsdale Road and Lincoln, so near Old Town. And a lot of people just find me through the internet or referral sources, and are usually pretty local. They're looking for someone that's close by, but I've also had people come as far as Mesa and Gilbert to see me, Surprise. So people further out will travel sometimes, and I usually try to accommodate them with schedules that work for them and for me.
Absolutely. It's got to work for everybody.
Yeah. When you're dealing with kids and families, you got to have some hours that work for them.
Absolutely. And I'm just going to state this because everybody's technology based, but this probably wouldn't be very effective via webinar or FaceTime, that sort of thing. It's definitely in person
Yeah, a lot of therapies you can do through a video chat, and actually I do that with some of my older clients when it's necessary. But I always prefer to be in person. And with children, I mean, you just can't play with children through a screen.
Right. Of course. Yeah, that's right.
So if you're bringing children to me, then it has to be face-to-face interaction.
Yes. And so do you find too, like with the families that come to you, and especially these younger ones that 0 to 5 range in through there, obviously the parents along with you, do
Mhm.
you find that it's most beneficial that the parents are getting some of the counseling too? Or is that incorporated in with them being there? Is it like a just actually working with everybody at the same time?
Yeah, it's incorporated with them being there a lot of the time. A lot of what I'm doing when the parent is there with the child is modeling for them what they should be trying to do at home. And then
Hmm.
if there's more specific strategies that I want to work with them on or that they want help with, then I usually have a parent session with them and we'll talk about that specifically so that we're not taking too much time away from the child. I always try to make sure that the focus is on the child when the child
Yeah.
is there. But you know, it does the parent no good if I take the kid into the room for an hour and then send them home and they don't know what we did,
Yeah. Right.
especially with younger children who aren't as verbal and aren't, you know, able to take their homework and do it at home. They need to have their parents there to support them.
Right. No, with some of these kids too, and I'm just kind of thinking of our practice space as well. Do you handle and are you capable of handling with like a severely autistic kid, a severely hyperactive kiddo with these families?
I have worked with a lot of children with ADHD, but I have sort of moved away from that. I haven't, that's not been my focus in the last couple years. I have also worked with some children who've been on the higher end of the autism spectrum, but for different reasons, such as the parent going through a divorce, that kind of thing. When they've been able to be more verbal and more articulate, I've been able to assist in situations like that. But for children who are just seeking services and support for an autism spectrum diagnosis, that would be somebody else. That would be a behavioral analyst, or
Yep.
there's other resources out there that I would refer to. Yeah.
Right, more focused on that particular
Yeah.
area through there, not just that, but just that themselves. Got it.
Mm-hmm.
Awesome.
However, I have also had where maybe a sibling is autistic and it's disrupting with the family environment, and other siblings are maybe coming to seek support because maybe so much attention is given to the the child with on the spectrum disorder, and they're looking for more attention and they're having struggles in school or at home, and it's just disruptive to the family. So in that respect I could help, but not directly to the child. That
I'm glad you brought that up because that is a huge one as well. It's not just a lot of times the focus is on the kiddo with the quote unquote label, but then,
yeah,
and then the other kind of quote unquote normal kid, one without the label is not
typical.
neglected, but not as much of that focus there. And I can imagine, I mean, we see it across the board is
Yeah,
that it spills over into the whole family dynamic and especially with those kids. So
it does. It really
that's
shifts the family roles.
Sure does. Absolutely. Well, I guess one other thing a lot of times people ask, do you accept insurance? Is this more cash based? What is as far as the financial side of things? People always question.
Yeah. Yeah, didn't even really think about that. No, I do accept Aetna and Blue Cross Blue Shield insurance, and then other people who have United Healthcare or something like that. I'm an out of network provider, so they usually pay cash, and I provide a super bill for them to submit to insurance.
Okay, great. And then let's say someone who doesn't have any insurance. Do you have any, payment plans? Anything along those lines to help those people that are just kind of paying the cash route?
Yeah, I mean, I would work with them on a payment plan. Yeah, I can do that.
Okay, great. Well, I thank you for taking the time. Thank you for providing us with a lot of this information about family therapy, about with what you do, your background and everything. You know, we're looking to keep these really kind of value based and kind of more that 5 to 15 minutes, which just provides all that value. And also, I want to thank you for coming on here, and I'm going to give your contact information across the screen here. You can either, I believe, call you or even email you, correct?
Mhm.
You can call you at the 480-808-6499 or email you at healplaylovetherapy@gmail.com, right?
Yep. Yep.
And that's the best way, just someone can reach out to you and just connect. And
Yeah, we can have a phone consultation is usually how we get things rolling, see if it's a good fit, if I'm able to provide the services that they're looking for. And then if everything works out, then we can schedule an intake appointment and go from there.
fantastic. That's awesome, Ashleigh. I appreciate you coming on. I know this is going to be beneficial for those that come across this, and because I know probably if even somebody's watching this, they know someone, if they can't benefit, I'm sure somebody else they know can actually benefit, at least at some point in their life. So it's always good to kind of know somebody when you need it.
Yeah.
So
Well,
thanks
thank
for
you
being
for
a
asking
valued
me.
resource for us.
Thanks.
Of course. Well, everybody, well, thanks for tuning in and paying attention to what we got here. Again, if you have any questions too for myself or even Ashleigh, throwing in some comments here, be sure to forward it on to Ashleigh. She'll be able to see it as well, being connected via Facebook. And if not, then we'll make sure you get connected if you need so. But as always, everybody out there, until next time, be elevated.